you over to speaker view. Good afternoon, everybody. It is officially 3 minutes past noon. I know we have a handful of folks who are going to continue to sign on, but we're going to go ahead and get started. I'm Brittany Quickcorner with the Eugene Area Chamber of Commerce, and I'm excited to have Randi here with us. She works for the City of Eugene, and I'll let her introduce herself and tell you all a little bit more about her. But I do want to say thank you all for attending. Thank you for following along on these Committed to Community webinars. We have been pretty excited to see the number of folks who are either following on the webinar or following along on Facebook Live or downloading and watching them later. It's been great that these resources have been helpful. We are always looking for other ideas for content. If you have questions that you want answered and we can help line up a speaker to do that, please reach out. We'd love to do that. Randi today is going to be talking about mental health and how we can be supporting our employees during this time, how we can be making sure we're taking care of ourselves during this stressful time. And just in general, you know, beyond when we're in crisis mode, how are we working to make sure we're taking care of our whole worker, right? Our whole worker health is the topic today. So without much further ado, I'm going to let Randi take it over, and you can intro yourself, and then we'll let you share your screen. I know you have a presentation that you'd like to give. So Sure. Thank you.
Yeah, thanks everyone. Thanks first for investing your time in this topic. I know all of you have many priorities and things that are stressing you out at this moment in time. So taking time out of your day to invest in your wellness and your employees' wellness, I think is a really good first step towards resiliency. And I think it's the first step that we as a community can take to getting back online and hopefully being even better than we were before. So it is with sincere gratitude that I think we start this. Brittany mentioned that my name is Randi Bowers-Payne. I work for the City of Eugene. I am the director of the Employee Resource Center. That is a new fun term for human resources and risk services. So the Employee Resource Center covers everything from emergency management to employee health and benefits, physical well-being of our workforce, so that's things like safety, as well as an entirely robust wellness program. We also focus heavily on financial well-being and resiliency. We've got a deferred comp program, and we really encourage our employees to contribute back to the community through financial wellness incentive programs and partner with the United Way every year. So I'm going to share my screen now and talk a little bit more about what you can expect as we go through this topic. I think I have this down. I'm learning all kinds of new technology. All right, so as Brittany mentioned, the purpose of this conversation, or the theme of this conversation, is supporting total worker health in the time of COVID. It's my new favorite thing to end a sentence in the time of COVID or in the time of a pandemic, because it makes everything a little easier. It also gives us a little bit of grace, and I think that's as important as anything, giving yourself grace so you can expand that to your workers. The purpose of this conversation or the talk that I'm going to provide is what we can do now to support health and welfare of ourselves, as well as our workforce in the time of COVID. And the hopeful outcome is one that you'll walk away feeling a little bit more energized and hopeful. Maybe you're already feeling energized and hopeful, and that's great. And if not, then this will get you started with some resources that aren't going to add a ton to your plate, but can easily be used in your daily work. And one of the benefits I have, I think, of coming into this conversation is for the last 7 weeks, I've been at the City of Eugene Emergency Operations Center. As of today, I am transitioning back into my regular role as the Employee Resource Center Director. But everything I'm going to talk to you about are things that not only are we doing as an organization for our workforce and encouraging our leaders to be doing, but that we were making time to do in the Emergency Operations Center every day. So in addition to making sure there's PPE for our first responders and hospitals, we were making time to make sure that our employees' mental health was being taken care of. So that's just to set the expectation that you're not going to walk away with ideas that feel entirely out of touch with reality. So what is this concept of total worker health, and well-being, and what do they all mean? So first, I'm going to give you a really high-level summary of the idea of total worker health, which comes out of a joint initiative from NIOSH, which is the National Institute of Safety and Health, and they work jointly with the CDC to identify what a total worker health employer looks like. And so the City of Eugene has the distinct honor of being a total worker health affiliate. And essentially what that means is that we have practices and policies that put employee total well-being at the forefront of the way that we operate. So processes and policies consider the total human and how that total human interacts with the society and community around them. Digging a little bit deeper, total worker health also acknowledges Gallup's elements of well-being. And if you've been plugged into the conversation about blue zones, or maybe you've just heard about this idea of well-being, those elements of well-being are listed on the left-hand side of your screen. Those are career, or what is more affectionately referred to as purpose well-being, social well-being, financial well-being, community, and physical. The awesome thing about a sort of science-based approach to employee health and well-being is that one of the things we know about mental health and anxiety is that in times of anxiety, the very best thing that we can do as individuals or leaders is to go to the facts. It's when we spin on our worst case scenarios or theories or philosophies that we actually don't show up as our very best self. And the total worker health framework and Gallup's elements of well-being overlap in providing us systemic science-based approaches to how to support individuals in living their best lives so that they can really support community in living their best lives. I was fortunate to attend the happiness talk that the Harvard Chan School of Business provided, and you may have heard about the happiness study. It's the longest running study on humans in the course of history. And it started approximately 80 years ago. They've been able to track through that study what individual indicators help make a person healthy and therefore allow for communities to be healthy. And I think that's relevant to you as business owners because if your employees are healthy, they're able to show up and support the work that you're asking them to do, and also to go out into the community and continue to stimulate business. And so total worker health is really top-down, bottom-up, middle-out approach. Everyone is responsible for well-being and for promoting the total worker health component. In the time of Gallup, there are a few elements of well-being that are, or I'm sorry, in the time of COVID, there are a few elements of well-being that are more relevant than ever. And I just would highlight social well-being, and that's the ability to connect with others and feel a sense of belonging as part of a larger group. Physical well-being, that is the ability to move your body. It's not necessarily exercise, but it can be. It's just natural movement. Financial well-being, a lot of folks are facing financial uncertainty, and you may be in that boat as well. And then the career component of well-being is really transitioning to more of purpose. It's where sort of your everyday actions meet a community need, and therefore, ideally, you're being compensated for that thing that your everyday action or your passion meets that community need. Right now, a lot of what COVID is asking of us, staying home, not opening our shops and businesses, and not being able to go to the gym or maybe hike on our trail, our favorite trail with all of our friends close by our sides, challenge the elements of well-being, which again, going back to a science-based approach to things, we know can have a negative impact on community, because when we as individuals are not well, we're not able to contribute to our local economies in the way that maybe we would want to. And so there are some things we can all do right now to help ourselves as well as our workforce to be well in those areas that are currently being challenged. A really baseline one that we've been working on with Lane County is reframing this idea of physical distancing instead of social distancing. COVID doesn't ask us actually to be socially distanced from people we care about. COVID requires that we're physically distanced, but we should still be maintaining social relationships and maintaining that connectivity. It's just in a different way, maybe a more creative way, but more important than ever that we're socially connected to one another in order for us to be well. The other thing I want to highlight here is Oregon went into this situation not really in a super well space. And that is to say, Gallup does a well-being index on a somewhat regular basis. The latest data that I could pull was from 2016. And importantly, Oregon ranked the bottom 5 in the entire nation for the purpose category, which means heading into COVID, many of us were struggling to find how our passion intersected with sort of compensation in the world and how we could make money and live a sustainable life. And so I think that's important for you to be aware of both personally as well as for your workforce, what challenges they maybe had before they even went into this. And so this is so far maybe ivory tower-ish and not exactly tangible for real actions you can take away, but I think the foundation is important as we go forward. And so I do want to just start briefly with a example of an exercise that we have used both in the EOC, the Emergency Operations Center, as well as throughout the organization. And there's a nice little graphic there on the right for highlighting what your purpose is. And helping your employees to sort of take a break and really regroup and identify how they can contribute their best self. You can provide space, or you can provide time or examples for exercises for them to do together. And this purpose exercise that you see on the left-hand side of your screen is one that we did really early on in the Emergency Operations Center, but shortly after not everyone, non-essential workers were sent to work remotely. And the feedback we got was just giving space, it was 5 minutes at the start of a city meeting, giving space for folks to think through these things was really helpful. And I encourage you to think creatively about whether you can carve out time for your staff to do this as part of a remote meeting, or if you're staying in touch with folks who are not on the payroll currently, then just providing this as a way that you can let them know you're thinking about them. A really important part of staying well and socially connected is knowing that others are thinking of you. And so this exercise may be really helpful for them to have access to either, again, with the scheduled time, or just for you to send it out and say, hey, I'm thinking of you, and this might be a nice thing to start your day with. It's also a good thing for us to stay grounded in as leaders, to remember how we're doing and what realistic expectations we have. I mentioned I'm enjoying saying in the time of COVID at the end of sentences, or in the time of a pandemic. And this exercise really can help reset expectations. We can't do all the things we normally did. It's just not possible in our current environment. It won't stay like this forever. I reject the idea that this is our new normal. And I sort of hope you all share that sentiment. We have an exciting future ahead of us, and we need to keep that in perspective, address the challenges in the moment, but also be ready to conquer what's next. And this exercise is a real easy one to help you do that. So I hope that if anything, after this is all done, you'll take some time to give yourself grace today and go through this exercise. So why is it important? I've talked a lot about Gallup's elements of well-being and the science-based approach that total worker health takes. But what does that all really mean? Well, the physical effects of mental trauma, which you're probably hearing a lot about this experience, both on individuals as well as young people, as having a traumatic impact, it can last for a really long time. And it's not just our ability to show up as our best self that suffers. There are some bodies of evidence that tell us that trauma has generational effects on folks. And so the idea that we're exercising and discussing and providing resources to our employees has a real ripple effect and a collective impact that I think all of us will want to get behind. Because without doing it, the economic impacts can be really long-standing. Importantly, just like anything we do, unfortunately, watching a YouTube video one time doesn't make any of us astrophysicists or astronauts, or even really good at a mindful practice. And so as important as it is to make these resources available to your staff, it's really important for you to carve out time and practice mental health and well-being exercises for yourself. It was a common saying, put your put your own oxygen mask on first. And I think we're thinking of that in a different way. Do you have your own face mask on first so that you can support the people that are around you? And without practice, you're not going to be able to achieve that. And so make sure that you're taking time to be resilient and finding exercises that work for you, and setting realistic expectations so you're not feeling like you're in a constant state of spinning or reactionary sort of forced actions. So if we're focused on ourselves and then we're ready because we have our own face masks on, what can we do to lead our teams or lead our organizations and work groups out of trauma so that we can bounce back both resiliently and also economically well? There are lots of resources around what operations management in the time of COVID could look like, but for me, Gallup is a good go-to because they do a ton of data collection. They tend to be non-politically based in their data collection, and then give really concise action plans. So the Gallup sort of guidance around operation management in the time of COVID is make sure and communicate a clear why of what you're doing and how and why you're doing it. That's more important than ever. A brain that's in trauma actually really struggles to remember information, retain, and consume information. So sharing the why in more formats and methodologies than you think are necessary will be part of the new normal at this time, at least. And so sharing that why, if you're closed, why you're closed, how you're closed, and going back to that, that factual information. As you're building a plan to reopen, talking about the why in your staggered approach or the why and how you're doing what you're doing. Make sure and provide stability for what you can. And I think that goes back to really providing the why. So if people understand why you're doing what you're doing, they're going to have a clear expectation or a reasonable expectation of what stable looks like and what it doesn't look like. I was joking with a colleague the other day that I feel as though I've aged 10 years in the time of COVID, and one day equals 10 months. And so stability today, my definition, looks really different than it did back in December, and that's just because of the changing nature of where we are. Make sure and provide hope. There is hope. I was just mentioning to Brittany before we started this conversation that I'm feeling really hopeful right now because we're starting to spin down some of our emergency operations center actions and move to the long-term planning for economic and community recovery. So my role is going back more to traditional employee resource center work, and that's hopeful, but it's also hopeful that it's raining today and that allows flowers to grow. If you need to go to that level of hope, it's okay. Make sure that you're sharing that with your colleagues, and also setting those expectations of what reasonable hope looks like. We're not going to all wake up tomorrow and be back to where we were in January. And that may be okay, and it may be really hard. And whatever that is for you, just make sure that you're communicating that and being gentle with yourself, but also identifying the hope. And if you can't find the hope, go back to the purpose exercise and think about what that can be for you. Be compassionate and acknowledge that this is complicated. And at one moment, you may feel an abundance of hope, and in literally the next minute you may feel that you don't know how you're going to get out of this, and that's okay. Both sides of those coins are okay and normal, and sharing that with your colleagues and with others who you're working with is really helpful for everyone being aware of their feelings, because when we're aware of them, we're able to work through them and then show up as our very best selves to carry out the work or the mission of the work that we're all working on together. So leadership, what can leaders do specifically? Well, provide emotional support, be a role model, provide instrumental support, and creative work family management. So one of my realities is that on the days I have been working from home, I tend to share the house with a 7-year-old and a 3-year-old golden doodle. I was on a call last week where the facilitator had a 19-month-old and had to jump off of the call and asked me to jump in and facilitate in her place. I didn't have a copy of the agenda, and that was fine because we're all being flexible. So jumped in and started facilitating the conversation. And a few minutes into it, my 7-year-old popped into the room with toilet paper stuffed in his nose and blood everywhere and informed me he'd broken his nose. But it was okay, Mom, because we could go to the doctor after the call was over. We're all in a different kind of work environment, and we need to be honest and flexible, and also be creative with our colleagues in this environment. But how do you apply these tenets in reality? So getting real, work-life integration means that employees are going to have to deal with the kid popping in, maybe with a bloody nose in the middle of a facilitated conversation. That's probably not what would have happened a couple of months ago, and that's okay. But if we don't talk about those realities, the stressors that are added unnecessarily to people trying to pull off being at work in a normal way when we're frankly not in a normal operation is untenable, it's exhausting, and it will not allow them to show up and contribute their best self in this time. And that's really what we need. We need to create space for you and for your teammates to be able to show up as their best self. Block out time and make sure that you have conversations. If you've still got people who are working remotely, or even if they're not working remotely and for some reason you're not able to have them working at all at this time, think about whether or not maintaining that social connectivity is value added for you. So the YMCA, I know, for example, is calling all of their members, and maybe even if you don't have folks that are on your payroll right now, just calling and checking in with them and letting them know that you're thinking about them is a way that you can show up for emotional support as well as be a role model for them. They can do that for others as well. And so when they see you doing it, it normalizes it. When you're a leader taking time out of your day to do that, it can have that sort of compounding effect that I talked about a little bit earlier. Define your own boundaries. It is really easy when you're working from home to want to run a 24/7 operation. One, it's not sustainable for mental health. It's also just not sustainable for your maximum creative and best self to show up for work. It's also not sustainable for your workforce. So make sure that you're defining what your boundaries are. So for example, in the Emergency Operations Center, there was a period of time when we had a no email, no text rule after a set period of the evening, and no email, no text or call before a certain time in the morning. Of course, the carve out to that is there are emergencies that need to breach those boundaries, but it's very, very easy to have work sort of bleed into all aspects of your life. And for some of us, that's energizing. And for others of us, it's not energizing. And even for those folks who are what we would refer to as integrators, where your work and your life completely overlap, there is a capacity for that. And so just being really clear about what your working hours are and what family obligations you have. Many folks are trying to juggle school in the time of COVID. And so checking in, one, with yourself, but also with anyone who you're trying to collaborate with on what those boundaries look like. Also, be a role model with anchoring yourself in the facts. It's really easy to spin on anxiety, especially if you don't check yourself and your colleagues on what the facts are. What are the real facts and challenges facing us immediately? Not our worst case scenario. There's time for worst case and best case scenario planning, but when we're particularly paralyzed by anxiety or stress, it's the time to go and be anchored in the facts and the resources. And finally, if you are offering paid time to your staff, or if you need to take time away, making sure that you're talking about that and normalizing that for people. We're all looking to one another for guidance in this time, and if we're not sharing what our own boundaries are and that we need to have a break as well, you're actually not making space for others to set their own boundaries also. So as leaders, we need to make sure that we're encouraging staff to use time if we still have staff on, and if we don't, then making sure that you're graceful to yourself and taking, even if it's 30 minutes, to go outside and take some deep breaths doing that, because this is a marathon and your wellness is critical to your ability to hit the finish line. Instrumental support, again, that's keeping one-on-ones if you had one-on-ones, doing those virtually. Identifying if someone is feeling overwhelmed, they might not have high emotional intelligence, or they might not know that you are going to be supportive of them. and setting those boundaries. And so just gently checking in with them. I see you're really stressed. I can hear in your voice that you're really stressed. What kinds of strategies are you using to create boundaries and be successful so that we can all come out of this and be ready to respond to what we're going to do going forward. Engage in a creative work-family management. So one of the things that we did today is to finally acknowledge that we have many staff who are working remotely at the same time their child may be sitting across from them or in the same room. And how are they dealing with ergonomics? How are they dealing with their physical wellness when they may be working at the kitchen table instead of in a healthy ergonomic setting? We're not going to buy new equipment for all of our staff, and my guess is you're not able to do that either if you have remote workers. But there are a lot of resources that are available online for creating a healthy ergonomic workstation from home. And one of the things we did was we expanded the conversation for those young people who are sitting side by side or partners. It wasn't complicated. SAFE has a great website with some ergonomic resources from home. It also allowed our young people to participate in a call with their parents, which we hope eased anxiety for moms and dads who are trying to work in this different kinds of environment. Let's see if I'm missing anything here. And then I guess the final thing that I'd just like to point out is I mentioned the boundaries around calls and texts, and that also goes for emails. As a leader, your team or community members, we're all looking to one another for what the norms and boundaries are. And so just really being intentional about, do you have to send that email at 12:45 or 2 a.m.? We all have, bouts of insomnia. It is normal, especially in this time, to be struggling with sleep. But what kind of message are you sending to a fellow community business partner if you're sending that email super late at night or really early in the morning? Is that the kind of community business that you want to support? I don't know the answer to these questions. You will have to answer those questions for yourself, but it's worth considering how you want to support creative work family, as well as role model and emotional support for yourself, as well as your community colleagues. So what do the behaviors look like? We've talked about some of the tenets, but specifically, what are the behaviors? So first, setting boundaries. Make sure and spend time with friends and family. That may feel like one added thing on your list, but if we go back to the facts and science based on well-being and wellness, social well-being is critical to overall well-being. And we know if we are not well people, we're not able to engage in the economy or the community in a really robust way. And so if you're motivated by nothing else, if the wellness and well-being of yourself or your colleagues isn't what motivates you, I hope the underlying business case for individuals being well so they can stimulate the economy will give you pause to invest in your own wellness and well-being, as well as anyone else who you can support. Physical wellness. So lots of folks immediately think this means going to the gym or going on a run. It might. Right now, it's not going to include going to the gym, obviously, but it could also include taking a walk in your neighborhood. And right now, although maybe not, I'm looking out the window, it's not raining now, but it's an opportunity also to connect with your neighbors. So out on that walk, you're promoting your physical wellness, but you're also connecting socially with people that maybe you wouldn't normally have the opportunity to connect with. We're also really encouraging folks who are on a Microsoft Teams call or a Zoom call, if you're able to get out and walk while you're on that call, that's another great opportunity. It's very, very easy to find your place in the corner of your house or at the kitchen table, plop yourself there and be consumed in your work for 12 hours. And so make sure that you're getting up and moving your body. There's a lot of great free resources, and some of those I've linked at the end of this PowerPoint, which include resources locally. There's some yoga studios, as well as other businesses who are offering free physical wellness opportunities for engagement. Practice excellent personal and emotional hygiene. Again, working from home, the easy tendency might be you just roll out of bed and jump right into working. Routine is really important to your mental health. I know it sounds silly, but whatever your routine was before, then I'm gonna go ahead and say, keep that daily shower if that was part of your regular routine. Don't skip out on it. It's really important. The emotional hygiene component we'll talk about in just a few minutes, but that's as important as your physical hygiene. You know, we take a lot of time to make sure that we brush our teeth because we don't want a rotting tooth or a rotting cavity. And there is a lot of emerging science that tells us that emotional hygiene, identifying those feelings and allowing yourself to work through them, are just as important as making sure that you're flossing and brushing your teeth twice a day. And so making sure that you're taking time for that. Get outside. If your physical wellness can be taken outside, make sure you're getting fresh air and enjoying all the awesome things that are Eugene. All of our parks are still open at this time, so go enjoy a park, maintain physical distance, but do enjoy the outside. The Japanese have a great practice of forest bathing, which there's a lot of science that says that's good for our mental health and well-being. And when we're well that way, we also are productive and we're creative, and we're going to need creative, productive folks to help us through to the other side. Stay informed, but limit media. So it's important to be able to anchor yourself in the facts, but it's also important not to be consumed with staying up to date on the latest piece of news. And there's no shortage of information right now with regard to updates. It can also be overwhelming and paralyzing. So make sure that as you're setting boundaries, that includes what your consumption of social media or news media is going to look like. You need to be able to limit that impact on your overall mental health as well. Identify a dedicated workspace. I've mentioned the kitchen table a few times. I've also mentioned work from home ergonomics. If you have a place that you can identify in your home as a workspace, even if it is the kitchen table, it will help you to achieve the boundaries that you set. And so if you're working everywhere in lots of different places, it will further allow you to slide out of a set schedule or a set boundary. And so a wellness behavior is identifying what that space is going to be. It's also going to help you stay organized in a different and remote working environment. Distract and redirect is sort of the last thing. One piece of advice that I have is, as you're practicing emotional hygiene and you identify that feeling of anxiety or that thought that is really distracting to you in accomplishing whatever you're trying to accomplish in that moment, take 2 minutes, meditate, draw a picture, think about what brings you the most joy, or if you could be anywhere right now, where would you be? And spend 2 minutes in that place. And just those 2 minutes, hopefully you'll find that you'll be able to be re-energized, and that distracting or anxiety-giving thought can be set aside. You worked through it and you've replaced it with the thought of joy, which again brings you back to creativity and productivity, as well as presence. So even if it's not about productivity or creativity related to your work, maybe it's you just want to be present with your friends and family who you're staying in with, or maybe you're virtually connecting with, and so those exercises will be helpful there as well. So I mentioned this idea of emotional hygiene and personal hygiene, and I made the analogy that we brush our teeth and floss our teeth. And this is not my concept. None of these are mine. I'm not a psychologist. I only work in employee resource center. But we do know these are science-based techniques and ideas. And words and thoughts, at the end of the day, they matter. It matters what we're thinking because it impacts our ability to show up. And so one of the things that we've been really intentional about is thinking about this term social distancing and the idea of physical distancing instead. There are other countries in the world that chose the term physical distancing instead of social distancing. And I think those little nuances, they matter a lot in our ability to show up. We do not want to be disconnected. A critical element of our ability to be well and our best self is connecting with others. And so how we talk about COVID-19 impacts our ability as business owners, as community members, parents, employees, et cetera. It impacts our ability to bounce back. If we're really focused on not being connected and sort of the worst case scenarios, then we're not thinking creatively about what this looks like on the other side and how we can come out stronger and better even. And so we can incorporate this into our daily work in a variety of ways. You can set a time every day, part of your boundaries or your schedule. Might include 5 minutes of mindfulness. There are great apps, and I'm not going to name them all because there are countless apps that you can use. I use the Insight Timer. It's got a time function. So if I only have 5 minutes to do a meditation in the morning, I can select 5 minutes of stress relief, or I can select 5 minutes of joy. And that helps me to center for the day, or if I'm heading into a difficult meeting, then it helps me center and be prepared for that meeting. I don't do it as often as I should, but you know, it's something that I strive for and I'm aware of. The other thing that you can do is think about what you allow to come into your space in this time. So what are we focusing our energy on, and why? Why are we looking at, you name it, social media page? If you're following something on IG, is it the thing that's going to help you to be your most resilient, creative, and best self, your best whole well self? And are you reading something that's helping you to be your best whole well self? So some examples of this include that we were starting meetings with poems, we were starting meetings with workshops or worksheets. We were working on planning, giving folks time to plan activities. Oh, and here's a perfect example. I have my 7-year-old interrupting now. So we're having to be flexible. Yes, you may. Yes, thank you. Yep, thank you. Daily affirmations are also really great. And even if you don't think that your workforce who is present or not present would be engaged, you'll be surprised at how well people take the opportunity to invest in a meditation or a affirmation together. And again, none of these are ideas that we haven't tried ourselves, either at the City of Eugene or even more recently in the Emergency Operations Center. So virtual connectivity. I've been talking a lot of the importance of connecting with others. I'm sure you have lots of ideas, and I encourage you to share them if you aren't already doing that. But I think most importantly is, to the extent you are able to keep your regular schedule, do that. So there are lots of platforms available that allow you to keep your one-on-one meetings, that allow you to keep your meetings with community partners and other businesses in the community, and just do that. Check in with them, even if it's not with the purpose of your normal agenda. How are they? What's going on with them? What's working well? What's not working? Keeping those connections. You might want to consider adding to your rotation, or adding back for some of you, those virtual happy hours. You know, if you used to get together once a month for a happy hour, that can look different, but it can still happen. Call your colleagues, call your partners across the community, play a virtual game. House party is one I've been hearing a lot about, and it's a great way to get silly with people virtually, but still stay connected. Of course, keep your lunches. If you can keep your lunch, do it from home, just in a different way. Maybe order takeout from a local business and have that virtual lunch still. You can still do that. One creative idea that we haven't tried, but I'll share because it was on NPR this morning and seems to be getting a lot more traction. Idea of a live remote office. Some folks really miss the sounds of an office. Some of us are okay not having all of those sounds, but you can either set up whatever your former environment was. So if you worked in a coffee shop, then you can set up streaming from coffee shop sounds. Or maybe you miss the sound of ping pong, or a colleague typing loudly, or even sneezing was an example this morning. Make sure and make that available. You can stream it. If you're just looking for ways to connect with folks who you normally work with in a different way, MTV Cribs is coming back, although virtually. So maybe it's time to find out how teammates or partners across the community are living, and what the best part of their MTV Cribs may look like. So those are some creative ideas that can keep you connected socially but virtually. So get started. What are some physical wellness activities? So breathe and then do it again. It's really easy to forget to breathe right now. Our bodies are supposed to be doing it all the time, although my watch reminds me a couple times a day, particularly when I may be more stressed out than others. So make sure you're breathing. If you are inclined or you're open to it, maybe participate in a breathing exercise that's available through an app. Sleep hygiene, sleep, and get some sleep. Sleep is really important to our ability to be resilient, present, well. It also helps us fend off illness. So make sure that you're getting your regular sleep routine, and if you can, getting a little more in, but not too much. Eat healthy. Right now would be a really easy time to get into some bad routines, eating unhealthy food and drinking too much. And so I'll just challenge you to find this opportunity to reset your eating habits, maybe plant a garden and go local, or order takeout from a restaurant that you've been avoiding that has a really healthy menu and you were hoping to not get food there. Or just try that new recipe that you've been thinking about. But whatever you do, really try and stay healthy with your physical wellness as well. Drink water, and then drink more water. I and a colleague use there are these noon tablets. So I'm not running around all day, but they keep me hydrated and help me to keep drinking water throughout the day. Move. We're seeing all kinds of fun things online about TikTok and dance offs. And so make sure you're moving, whether that's outside or inside, but then enjoy a laugh. So share your movement video with someone who you can laugh with. These are all linked, and I'll make sure that Brittany has the live links. These are some really easy ways to get you started. There's total worker health tips for working from home that are linked there. An ergonomic assessment, I shared that we just did that for city staff, including their children and partners who may be working from home as well. SAFE has great resources on their website, and so I've linked that there. Schedule time every day for healthy activities. Again, limit your daily social media and news. Focus on the facts when you're feeling the most anxious, and build a daily self-care routine. These are some of the examples of worksheets that we've either explored or used versions of in the city, and can be really helpful for us as leaders in planning our day and or just staying connected with people who you're not able to work with on a regular basis. And so, these are great resources that are available online. They're free, and you can start a meeting with them and ask folks to share them out, or you can just provide them as a resource for people being able to do that emotional hygiene on a regular basis. Here's some more resources that I am providing to make this accessible for you. I'm not going to go through all of them, but I would encourage you to follow the links to those that will be the most helpful to you. Again, just really highlighting that our total worker health, the idea that what we do at home, quite literally in this time, impacts our ability to show up as our best self at work, also has a community impact. And so you'll see resources here about parents, because we know that parents are struggling in this time, and if they're struggling at home, that tends to come to work. And if you're offering a health plan, it shows up in your health plan costs. It also shows up in their ability to be productive and creative. And so there, again, is that business case for making sure you're taking care of the whole and total worker so that we can all bounce back from this. I mentioned there's a lot of free local resources. I did not capture them all here, but here are a few that I quickly was able to pull from online locally. The City of Eugene's got some free virtual rec classes. It might be fun to host a virtual sort of meetup with colleagues or with some of the folks that you're not able to have coming into work right now, and move your bodies together. The Eugene City Library has expanded its online courses. There is a ton of information available, from movies to podcasts to learning new languages, and those can all be accessed from the City of Eugene website. The YMCA is offering free online classes. The Wellness Council of America has an employer toolkit for the health and wellness of your workforce and what you can be doing. You'll see some of that overlaps with what I've been talking about. Vista is offering some resources as well. And then Common Bond Yoga also has some things available. And I'd be happy to build from this list, and I'm sure that some of you have other resources. And so I just continue to encourage you to keep in touch with one another and share resources that are working for you and your workforce. And then if you have any questions, feel free to reach out to me. Happy to be a resource to you and share any kinds of things that are working for us at the city. Really, we work for you. And so just reach out and let me know how I can best support you. Thanks so much.
Awesome. Thank you so much, Randi. This was great. I feel like you mentioned a couple times, not a lot of it is stuff that we don't tell ourselves every morning, like, God, I just need to be more intentional and more mindful. But I took down some notes that as a leader and employer, I think it's important for me to make sure that I'm empowering my staff to do the same thing. I always hope that they know, that they assume that I'm definitely supportive of that, but I think that we have to do more than just assume that. We have to tell them and frequently remind them that we're supportive of people taking breaks and, taking time for themselves. And I think that's a big takeaway that I'm going to have from this. We have a handful of minutes left for questions. I don't know if anybody on the participants, if you want to unshare your screen, there we go. And we will be sharing this document that Randi put together with everybody who attended today. So we'll follow up this afternoon with an email with that. But we have a handful of attendees still on here. If there's any questions, happy to take them. Randi, I'm curious, from the perspective of the Emergency Operations Center, how are folks preparing to go back to what was normal before that? Have you guys talked a lot about what reintegrating back into the office looks like?
Yeah, so part of my transition back to my normal role will include a lot of that planning. But if we look at what other countries are dealing with in terms of this sort of role into the office or back into a physical environment, one of the things that we're preparing for is that we're going to deal with, one, this emotional trauma that people are facing, two, that some people are just going to have anxiety about leaving their house in general, and we know this is going to be a staggered approach to getting people back into the office. And so one of the things we're really talking about right now, at least in the ERC or the Employee Resource Center, is how do we support that slow and staggered approach to coming back to the office in a way that also allows people's psychological safety to be supported. So before we went remote, we were doing hourly cleaning processes and had made some significant changes to our conference rooms, and I anticipate those will all be components of getting people back to work. It's going to be as important that they're physically safe and psychologically well.
Yeah, that's wonderful. Thank you. Well, I appreciate your time. I know I feel like our sound is a little bit funky right now. Hopefully folks can still hear us. I appreciate your time and just, your insights and how you are supporting your staff. The City of Eugene is a major employer for our community. And so we appreciate that, that the folks who are working for the city are mindful of all of these best practices as well. So appreciate it, and I hope that you're staying well, and I look forward to our lunches again in person sometime soon.
Take care. Thanks so much.
All right. Thanks, everybody. Have a good one.